Hello, I am Dr. Thompson Akwo, international physician, political leader, international communicator, certified professional and expert in global health, USA. Global health updates. Today we finished the meeting with the Director General of the World Health Organization, Dr. Tedros Ryan, Maria Van Kerkhove, Swaminathan, and the others. The focus was the situation in conflict regions, with the emphasis and focus in Ukraine, the Russia-Ukraine war that is predominantly being fought in the country of Ukraine. Dr. Tedros and other members of the directorate in Geneva paid a visit to Ukraine to see for themselves what's happening on the ground and the health and humanitarian impact of the conflict on the people. The World Health Organization has supplied about 6 ambulances to Ukraine to augment the work of WHO staff on the ground. But as Dr. Tedros made it clear, 150 million US dollars, 150 million US dollars have been marked for the health, medical, and humanitarian response by the World Health Organization and its partners in Ukraine. And so far, thanks has been given to countries and leaders and individuals who have contributed, but $100 million is still lacking. And the world and member states and some of the rich in the world are being called upon to do more, so that the World Health Organization's preparedness and response in Ukraine can be properly financed. It is said that Ukraine has created multiple other humanitarian issues and problems, or made them worse. Amid the conflict, there are now issues of food insecurity and shortages around, because like wheat and other food items which were predominantly supplied out of Ukraine have been compromised. There's less production, and there is very little export out of Ukraine. And so we know that food and water is an aspect of our global health modules and work, where we begin to have compromised food quantities and quality, then there is a problem. And then when there is inadequate food supply, shortages, then we have malnutrition and related problems. Migration, because under our global health work on environment, climate, and migration, we see that wherever there are conflicts, people begin to migrate. And as they move along, they go to bordering countries, they find themselves in overcrowded shelters or makeshift living conditions, which on their own may create a problem, and infectious diseases, diarrheal diseases, or fecal-oral diseases related to water and sanitation, and all those global health issues that we deal with, stress, improper nutrition. For many, their medications and related healthcare commodities may not be available. So then you have a problem in your hands when you are dealing with scenarios like that. So it's piling up of one global problem on the other and complicating others. Climate, food insecurity, medical and health commodities, health needs. The situation in Ethiopia, in Tigray, was discussed, and it's sad to know that the humanitarian medical needs and food needs are not reaching where they need to go because the convoys or the trucks are not having access. And as Dr. Tedros said, talking to the governments of Ethiopia and Eritrea, making a plea and a strong request for them to let the humanitarian trucks and resources get to where they need to go. Yemen, Syria, and all these other conflict spots where there are problems which complicate global health work. There are also healthcare personnel who flee war zones. And in their absence, we know that the health systems of affected war countries is compromised, because one of the pillars of the health system is the human resource pillar, human capacity. And so when healthcare personnel begin to migrate or to flee, then the needs, the healthcare needs of the people, the everyday people who remain behind, even some of those who are caught, in war, are affected. So at this point, there are many who believe that there have been a shift of focus from COVID-19 globally to Ukraine, and asking if it's not time for the global health experts and the World Health Organization and other multilateral bodies who are involved in global health work refocus. And as Dr. Ryan said, yeah, there is the need for that question, but it's not as much as refocusing as it is placing sustainable focus in the different areas that global health experts have been working. Be they, national vaccination programs and Gavi, or the Global Alliance for Vaccination, and all the others. Maria Van Kerkhove was very clear that B1, B2, or BA1 or BA.1, BA.2, BA.4, BA.5 are problems as relates to COVID-19 variants, and that South Africa is predominantly dealing with BA.4 and BA.5, and that some of the problems that the world is facing as to the global response is the reduction in testing. So when there is underreporting, because the tests are not done as there have been reduction in testing in different countries, especially in the West, in America and other places, people don't get to know have the big picture, and there is that caution. And national leaders are told to look at some of these issues again and try to recalibrate. The question of China and the national policy of zero COVID was addressed. And global health experts believe that the zero COVID strategy of China is unsustainable, and that there is a need for balance between the preventive measures in place and the economic activities of the population. Because if you are going to put in place very strenuous preventive measures in order to have the zero national strategic policy or plan, the people may not be able to cooperate. And then the human rights of the people will begin to be trampled upon. And then there will now be other problems related to that. And so Dr. Tedros, the Director General of the World Health Organization, and his team spoke with Chinese health ministry leadership to look at the zero COVID policy of China again and try to see where they can tweak things here and there. The question of booster. As the chief scientist made it clear, yes, boosters or the fourth dose can be given to certain people, especially those above 65 years old, people who are highly vulnerable, the immunocompromised, people on chemotherapy, on steroids, on medications that depress the immune system, and people who have immune diseases and problems. It's acceptable for them to get a fourth dose. Otherwise, generally for Pfizer and Moderna, the protocol is now 2 doses and a booster, which is 3 shots. So the WHO is very accommodating in that area. And the need and the guidelines and the acceptance by the World Health Organization for nations to have about 70% of their populations vaccinated by mid-2022 is still being promoted, even though there are countries in Africa that the immunization level is not up to 25%. Some of those countries, they have problem with vaccination hesitancy. So there is need for mobilization of global health experts who work in the area of global health communication and health promotion to go into some of these communities and do global community health work, so that the people can be reliably informed using data and evidence-based guidance in their response to COVID-19 vaccination. Overall, there are some countries that have come out of the epidemic phase or the emergency phase of the epidemic and maybe moving to what they'll call living with COVID, and then the long COVID and all of that. Questions which were factored into it. Then recently the issue of a resurgence in hepatitis B, as has been reported by